going to a 4-year university, which was the University of North Carolina at Charlotte. And I actually changed my major and practiced social work. And so I have a bachelor's degree in social work. I worked in social work for about 6 or 7 years and really enjoyed what I did. I enjoyed a direct care with patients, but at the time I did not want to go further with that to be executive director or further up due to bureaucracy and just all those things. But at the same time, I was married and had a new baby, so I needed some more money, so to speak. And so I did a change of career, and that's when I went back for my nursing degree. So I went to Presbyterian School of Nursing, which was at the time at Queen's University, and got a 2-year degree in nursing. And so it was considered ASN, Associates in Nursing. And that was a 2-year degree. Fast forward, I worked as a nurse at Novant Health Presbyterian Medical Center and stayed there for about 7 years. And I have always been a psychiatric nurse. I've always worked in mental health. That's my love. And the reason being is that social work is so much akin to behavioral health that it was an easy flow for me. And so after being at Novant Health for a while, I decided to leave there and ended up coming to the VA Medical Center in Salisbury, which is where I currently work. I went to Winston-Salem State University and obtained my bachelor's in nursing, and that was a year program. And then eventually went on to the University of South Alabama, where I obtained my master's degree in nursing in addition to my psychiatric nurse practitioner degree. And so here I am. And I think that my story is a little different from some. Some people know what they want to do right off and they go straight through, get their nursing degree, go to nurse practitioner school, and they're done. I took a longer route in that I started from the bottom and now I'm at the top tier as an advanced practice nurse. So I've seen every avenue of nursing, from the nursing assistant to an advanced practice nurse.
Very good. That's quite a journey. Lots of education there.
Yes. I've been in school long enough to be a physician.
Yeah. Well, would you like to tell us a little bit about what it means to be a nurse practitioner?
Mm-hmm. So a lot of people question, what is the difference between a registered nurse, a nurse practitioner, and a doctor? And so I'll kind of give you an overview, and I'll try to do it in tiers. And so you have a certified nursing assistant, and that's someone who works directly with the patients to maintain and help them with collecting vital signs, their everyday activities of daily living, like feeding, bathing, and taking care of them in that way. So they're actively engaged with that patient on all those levels. Then you go to a registered nurse. And so a registered nurse is one who observes the patient, assesses the patient, evaluates the patient, gives medications if needed, whether they be through injection. They are, if you've ever been to the doctor or been hospitalized, it's the person you see the most that are very hands-on with you. And so that's a step up from the CNA. I'll go backwards for just a second. There is a licensed practical nurse that's in between there, and she can do pretty much everything that a registered nurse can do, with the exception of a few things like teaching and certain assessments that the LPN can't do. So you see a lot of them working in nursing homes, and then they're bringing them back into the hospital also. And then, so after the registered nurse is your advanced practice nurse. There are several advanced practice nurse degrees. There is a family nurse practitioner, a psychiatric mental health nurse practitioner. You have your clinical nurse specialist, and you have your clinical nurse midwives, and then your nurse anesthetists. And so your nurse anesthetists are those who actually work. Can you see me? Because I clicked off. Hold just a second. Here I am. Yeah, those who work with the surgeons during surgery, so they make sure that the patient's anesthesia is going well. That is one of the highest paid nursing degrees that you can have. I don't have that one. But back to psychiatric mental health nurse. It is akin to a physician in the sense that as an advanced practice nurse, we have the ability to prescribe, diagnose, and manage the care of patients just like a medical doctor or a psychiatrist can. In the state of North Carolina, we do not have full practice authority at this time, so we work underneath a supervising physician, which is usually either a psychiatrist like I do myself or a medical doctor. And so that just kind of gives you an overview of the different levels of nursing and what it kind of takes to get there. And there's different levels and, of course, different schooling to obtain those degrees.
Oh, very good. Does anyone have any questions so far? You can unmute yourself and ask.
Don't be shy.
You were very specific and detailed, so they very well may not have any yet.
There's a question.
Oh.
Have you ever worked with criminally insane or something similar? So to Tyler,
yeah,
I don't work in forensics. And so there is a special area for working with those type patients, and that is in forensic psychiatry. And so I don't work there. However, I do work with acutely ill patients because I work on an acute inpatient psychiatric unit. So many times we do get patients that come in that are psychotic, that have diagnoses of bipolar, schizophrenia, schizoaffective disorder. And so they are at those very delicate stages where they do need to be hospitalized. So we see a lot of that, more so in my previous job, but yes. My title is Psychiatric Mental Health Nurse Practitioner, and currently I work at the VA Medical Center in Salisbury.
Anyone else so far?
I wanted to ask about the University of South Alabama.
Mm-hmm.
Did you have to go to the University of South Alabama, or was that online, or was it hybrid?
Okay, so the University of South Alabama, as I live in North Carolina, so I had to go to Alabama, which is in Mobile, one time for orientation, and it was like a 3 to 4 day orientation. The next time I had to go to the University of Alabama was when I graduated, and so it was all online. Someone asked, what is my next career level you will obtain? I am done. I don't plan on going back to school. If I do, it will be for like a certification in substance abuse or something like that. There is a echelon degree, which is a doctorate nurse practitioner. I have no plan to achieve that, but you can. I could be Dr. Campbell, but I have no plan to do that.
I think Tyler was asking what kind of types of veterans you work with, and maybe you should just talk about like a normal day.
Okay, will do. So yes, Tyler, I do work with veterans and solely veterans because it's the VA, that's who we see. And so yes, post-traumatic stress disorder. And I work with all psychiatric disorders. So in my typical day, when I come to work, I listen to a report from the patients that are on the unit, and they tell me how they're doing, what reason they came to the hospital. I have an assignment that I take for that day that consists of different patients, and they all have different diagnoses. And so I see those patients individually. Usually I'm with a social worker. And so she and I see our patients, we figure out what their needs are, assess them, evaluate, diagnose, prescribe medications for them. Many times we have to involve family to contact for collateral information, or have a family conference with them just to see how close to baseline these patients are before we send them home. Just this morning, I had to participate in a court hearing because we do have patients that may be involuntarily committed and need to go before a judge to determine how many days they need to stay into the hospital. So that occurred this morning. And that's my typical day. There's documentation, of course, that plays into that. So I spend some of my day documenting on those patients. And then any other task that my boss so chooses to throw at me during the day. Yes, I do have repeat clients. We have veterans that come back. It's good and it's bad in a sense, and I'll tell you both sides of it. It is good because these veterans know where to go to get help, and they're not afraid to come back. Um, it's bad in the sense that it's a revolving door, so to speak, and so you kind of get discouraged sometimes when you see the patients coming back over and over again. But they're well and they're safe, and that's kind of how you have to look at it, and you do the best that you can for them and make sure that they're stable to go out and kind of try again. Yes, you have CPI, Tyler. I had to have CPI for my previous job, which was at Novant. That's what they actually use as their Crisis Prevention Institute. And so we use something different here. It's called PMDB. It's Prevention of Disruptive Behavior. And so we use a different model, but between you and I like CPI better.
I think Savannah also asked if it was difficult taking classes online.
It depends on what kind of person you are. I did a hybrid when I first went to school for a nurse. I did a hybrid course for what was it, developmental psychology. So I had a little taste, and then at Winston-Salem State, most of my classes were online. USA used a platform called Sakai. It's similar to Blackboard and similar to Canvas, and I really enjoyed it. It was very user-friendly, and we never, honestly, I can say with assurity, I never had a time where the computer went down or the system went down and I could not do what I needed to do, and that was my fear. Being so far away and not having somebody to talk to if I was having technical difficulties. And at the time we had a program where when we test, we would actually have to be monitored while we're testing by video camera. It was called RPN Now. And so we would be testing and they'd say, you got to scan your room and make sure you don't have any cheating material and nobody else is in there. So that was kind of nerve-wracking, but you get used to it and you just, barrel through and do it. It takes self-discipline. And so you have to have some self-discipline to sit down and do stuff when nobody's standing there telling you to do it. Well, Tyler, you sound like you're on the right track.
All right. Any more questions? I know you guys have some.
I know nobody's asked about how much money I make.
Maybe they don't want us to be embarrassed that work for the school system. Yeah, how much do you make?
So currently at the VA, nurse practitioners start at around $78,000. And it goes up from there depending on your years of experience. And each year in the VA system, we have what they call a step increase. So every 2 years, you increase your salary by about $2,700. And then you get little bonuses based on performance throughout that. And then, of course, if the state of North Carolina or federal government decides to give a boost, they will. Now, in comparison to private practice, they make a little bit more for their experience, not private practice, but private hospitals, a little bit more. So if I'm at the VA and I'm a new grad, I'm starting out $78,000, there may be $5,000 to $10,000 difference of pay at a private hospital. So the VA's got some catching up to do is what I'm saying. But as a new grad, I'm good with that. I'm okay. What made me want to become a doctor? Not a doctor, so to speak, but I was at a crossroad with my nursing career. I wanted to do something more, and I really love medicine, and I love being able to help someone feel better. That is a reward in this job, is seeing someone go from being acutely psychotic to being able to have a conversation like you and I are having right now. That is rewarding. I wanted to be the person to make that happen. And that's what mostly drove me to get my advanced degree. I do see that, Tyler. And so you would definitely work in forensics. So where am I from? Originally, I am from, you guys may know where Fayetteville, North Carolina is. So I am from Lumberton, North Carolina. That's my hometown. And so I moved to Charlotte, North Carolina to go to the University of North Carolina at Charlotte. And I love Charlotte. It's not too small, it's not too big, so I stayed there. And she asked me what my workplace is called, the Salisbury Veterans Administration Healthcare Center. So I do commute. I have a 56-mile commute, and that's one way. So 112-mile commute each day.
Were you mentioned the difference between private hospitals and the VA?
Mm-hmm.
Would you I'm not sure how to ask this. Like, what benefit does going to the VA have, since it isn't paid quite as much?
Mm-hmm. And so I think the benefit of working at the VA comes with older age, so to speak. People talk a lot about, having a pension after you've worked for the VA when you retire, life insurance and medical insurance after you've worked here for so many years, you just automatically receive that. So it's the benefits that people look for when they come to work for the VA. There are limitations when you do work for the VA. For example, I don't get to see as much a variety of psychiatric cases as I would if I worked in the private sector, because they're veterans and so they do present with some of the same issues. I think it was Tyler that had mentioned PTSD, and we get a lot of patients that suffer from post-traumatic stress disorder. That's just comes along with being in the military and being exposed to so much trauma in combat. And so that's one of the downsides to it. The other thing is the VA is a culture. Each facility, whether it be private, whether it be VA, they do have their own culture. And so the VA has their own culture and are kind of, I don't want to say behind the times, but it's the federal government and things don't move as quickly here as they do in the private sector sometimes. And so that can be somewhat frustrating, but if you know where you work and you know what to expect, then it's not such a downfall or hazard to deal with.
Thank you.
You're welcome. I'm trying to make sure I didn't miss any questions. Scrolling here.
Yeah, you've done a good job keeping up with them. It just amazes me the differences in the different types of nursing careers that you can have.
Mm-hmm. And even at advanced practice nursing, there's like 4 different advanced practice nurses. If you like delivering babies, you can be a nurse midwife. If you like the leadership and the busy work and managing people, you do the clinical nurse specialist. If you like medicine, you do the nurse anesthetist. That's not my forte, so to speak, but there's somebody out there that does it. And so a lot of different levels that people can engage. And then if you want to be Dr. Campbell or Dr. whoever, then there's the DNP route, which a lot of schools are pushing for the DNP route and offering that more now. The state of North Carolina has not made it a requirement. And if they do, hopefully they'll grandfather us in to the extent that we won't have to go back to obtain that, because I don't want to go back to school. Can I discuss any continuing education you may have to do? So as a nurse, I had to do 30 hours of continuing education every 2 years. And it is pretty much the same as a nurse practitioner. My job that I do counts for half of that. And then I spend my time doing my job requirements, which are, we have a talent management system that has these modules that we do, but participating in webinars and the AHEC has, which is the area for, I don't know, health education, I think. I don't know what the acronym stands for, but we can go to their conferences. You find a lot of free stuff to participate in, so you don't have to pay for these CEUs, but they're pretty easy to obtain and keep up with. So it's not something that's kind of like crazy to have to do in addition to my workday.
That's sort of like being a teacher.
Yeah, you got extras. Yeah.
Yeah, yeah.
One thing I want to say to you all, and this goes back to my very beginning. Somebody asked, well, why didn't you stick with nursing when you knew you wanted to do it in high school? So I come from a small town, and the thing you were supposed to do at that time when I was in high school was graduate from high school. That was what was important. It was during a time when there was a lot of high school dropouts, a lot of girls getting pregnant in school and just not moving forward. So it was you had to at least graduate from high school. So when I decided I was going to go to a 4-year university, that was like, whoa, I'm going to college. It's awesome. And so I kind of scared myself out of going into the nursing career because as African American, I did not see nurses, not in my family. I didn't see African American nurses when I went to the hospital with my mom or in the community. And so it's not something that was in front of me. So I scared myself out of obtaining that career. Now, look back on it 20 some years later, of course I could have did it. And so I say that to say to you, don't let anyone, not even yourself, talk you out of what you want to do. If it is in your heart to do it, you can do it. I wasted some time because I was afraid. I could have gotten this degree a long time ago. And so when I came to the crossroads again to decide, okay, am I going to get my nurse practitioner or am I not? That fear came back. Can I do it? You know, that negative self-talk that we can do sometimes to talk ourselves out of stuff. But then I had to convince myself and say, you know, we've been here before. We were here in high school. Let's move forward. And so I pushed myself, and I'm asking you guys to push yourself and do whatever it is in your heart that you feel like you want to do.
You're motivating me. Yeah, that's great advice for our students. Our students have an opportunity to take nurse aid classes dual enrollment through DCCC. Would you recommend them doing something like that?
If you are at all interested in the nursing career, that is a great step. You're still in high school, you're not losing anything from it, you're going to gain credit for it. And if you decide to stay, you'll be ahead of the game in that you will be able to get a job as a CNA once you graduate from high school. In addition to that, if you decide to go further and obtain a degree or go into nursing school, they're going to require for you to have your CNA first, because you have to do clinicals, and in clinicals you're hands-on, and so being a certified nursing assistant is a requirement for you to have that when you go into nursing school. So it's not, you're not losing anything from doing it, you'll only be gaining. And then you would have, you know, convinced yourself if you like it or you don't like it. Some people don't like blood and guts and poop and pee, and they figure that out very quickly. And then some people get in there and they just absolutely love it, and all the fluids are a non-issue. So.
Well, thank you.
And somebody said something about ER nursing and mental health, and you're absolutely right, because the emergency department is the entryway into the hospital. So they get a little bit of everything. So they do see the psych patients typically first before they get moved to an inpatient psychiatric unit. And some of them, you know, leave from the ED. They just come in and they just need a med adjustment and they send them right back out. But for the most part, they come to the ED first.
Anybody else? Well, Miss Campbell, we don't want to take your entire lunch from you.
I get an hour. That's a bonus to be a nurse practitioner.
Yeah, that's pretty good.
I only got 30 minutes as a nurse, so I had to rush and do everything.
Well, they should give you an extra hour since you're helping high school students.
I know, right?
Yeah.
I might take a little extra today.
Yeah.
I wanted to ask, how many children do you have?
I have 2 boys, ages 17 and 11. And I was in nursing school with both of them. With the second one, I actually was pregnant in nursing school. So I tell my husband all the time, I said, that's why he acts out, because I was pregnant with him and I was crazy. But they're good kids, they both are.
Well, I guess that's all the questions we have for you. Last call, folks. All right. Well, we really appreciate you joining us, Ms. Campbell. I learned a lot myself.
Good. Well, I thank you for having me. I'm glad I did it. I'm glad I had time to do it. I appreciate you reaching out.
Yeah, we may end up reaching out to you later on in the year. So,
Okay.
yeah.
You got my information.
Yes, ma'am. Well,
All right. It's nice meeting you all.
It's nice to meet you.
All
Have a
right.
wonderful day.
Thank
All
you for
right, you
being
too.
with us today, Ms. Campbell. We really appreciate it.
You're welcome. Thank you.
Take care.
Bye-bye.